Miss Vasquez.
Hello.
Miss Vasquez is a Fort Bend ISD teacher.
I am.
Tell us a little bit about yourself.
I'm a kindergarten teacher at Fort Bend ISD. So this is my summertime, and I am 44. So I've discovered that now that I'm 44, it's a little bit harder to lose some weight and get rid of some unwanted fat, especially right here.
Yes.
And so that's why I've come to Dr. Shel to help me with my chin area using some Kybella, and I'm also treating some unwanted fat on my lower region with Vanquish. So I'm excited to see the results.
That's great. And you had your first treatment today.
I sure did.
What did you think about it?
It's not as bad as I thought it would be. It's actually it's as if I did some sit-ups.
Yeah, it's good. It's good to do those where you don't have to work for the sit-ups, but the sit-ups are done for you. So Vanquish Me, what it is it's basically generating heat. It uses radio frequency, and it's contactless. So we apply the applicator. What's great about it, we do a lot of cool sculpting, but Vanquish Me is different in that sense that it can cover this entire area with just one applicator. So what we did today is a shrink wrap procedure where we did the front and the back, so it hits the side twice as well as this entire area. So we'll talk more about that another time, but we're going to be doing that for Ms. Vasquez once a week for 4 treatments, and we also do some Cellutone after that to really mobilize that fat. Hydration is very important, and with 4 treatments she's going to see some great results. As long as we're eating healthy and hydrating well, she'll see great results. So now back to the Kybella. What I'd like to show the viewers is when you look at the chin, this is the area that really bothers her at this point. And this is, there's a genetic component to that. So some of us just are blessed with that chin that we just can't get rid of. And so the Kybella procedure, what it's going to do is we're going to inject these little spots. We have already made a blueprint of it. And we definitely stay away. Here's the thyroid notch. We stay away from that. So we're going to stay anterior to that and then only do the area where her fat, and you can see this. So each of the spot is going to get about 0.2 mils of the Kybella. And what that's going to do is go in and kind of rupture those fat cells. And once those fat cells are ruptured, your body can get rid of those fat cells very well. And what's really great about what you're doing right now is you're getting rid of fat cells here and here. Mm-hmm. So hydration are going to be very important, detoxification. In fact, I'll actually give you an infrared sauna today so we can kind of get that moving along. Okay? So you ready?
Yes.
Perfect. Okay, so we're going to get started here. She's already been cleansed, and I'm just going to kind of wipe her one more time. And get things ready. And where you see my white line, we're going to be staying within those white lines there. Okay. All right, my dear. And you can just relax and squeeze that ball. So we're going to start in the lateral area, and we go into the subacute fat here. There we go. You okay? Mm-hmm. Perfect. I want you to fill up 0.8, not 1, please. In each. So I'm going straight into the area and placing exactly 0.2 in each. You all right, my dear?
Mm-hmm.
And I'm following this pattern so that I don't miss any. And I know exactly what I'm going to do. Can someone just be, Dr. Mullers, can you tell me the oranges, please? I might lose track of where I am. All right. How you doing?
Mm-hmm.
Good. On a scale of 1 to 10, are you feeling much pain?
No.
Good. She's barely bleeding, which is great. Perfect. Doing great. It really doesn't hurt. It's just, you feel a little sick, and that's about it. is really, you're a great patient here, my dear.
Thank you.
Excellent. Thank you. Doing great. Now she is going to have some swelling, and that's normal. Okay? I'm going to come around this way. In fact, it's perfectly normal for her to have swelling immediately and some redness. That just means we're placing it in the right place, and she's going to have great results. How are you feeling?
Okay.
Need a break?
Mm-hmm.
Okay. Take a deep breath. Put yourself in a happy place. Okay, good. And this is great for just a little bit of distraction. All right, good. We're not too far from being done. So you're gonna do great. Thank you. And as you can see, I'm going right next to the line. Perfect. We have a few more lines to go, and then we'll be done. You okay?
Mm-hmm.
Good. So what do you love about teaching kindergarten?
Well,
Do the kids behave?
you teach them to learn. You teach them about school.
Yeah.
What I do love is that you see tremendous growth.
Yeah. Yeah. It's like the fruits of your labor,
Mhm.
right?
Mm-hmm.
That's awesome. I'm sure you're a very loved teacher. Have you lived in Fort Bend for a long time?
Yes.
Perfect. We're almost done. Okay. Couple more lines and we're all done. Mhm. Okay. So with Kybella, it's much like when we do Cool Mini. Cool Mini is another procedure that we use to get rid of the unwanted fat beneath the chin, and people get great results when you do a combination approach. So oftentimes we do that. We do a combination approach of combining the two together. And so with that you're using the actual Kybella and the product, as well as freezing the fat cells and then leading to apoptosis. Okay, I'm going to give you a little break here. Hold this. Okay.